4518. Again, that's 671-638-4518 or 4519. You can also email era@doa.guam.gov.
Thank you, Sabrina and Dr. Hoa. It looks like we got you now. We had to kick the kids off the Wi-Fi, right?
Yeah, I think so. Anyway, the children vaccine are important. I think that there's no urgency on the vaccine. They have to get the vaccine before December. But I think the most important thing for everyone to do is basically educate the public, the parents, about the safety of the vaccine and the importance of vaccine before you push. So I think they should be. I think they have a town hall meeting tonight, public health with the parents for GDOE, and I think those should happen a lot more, just to put the information out there. Again, I talked to a few people on the school, and the vaccine should be given to the children only when the parents are there. There's no choice on that one. Yeah. It's a lot of risk to give the vaccine to children without the parents present. So, that has to be planned carefully. I think during the school day, it's kind of hard for the parents that work that would have to make time to be there. So the most important thing is that probably make it convenient for the parents to do after school hours or during the weekend. Yeah. So that way parents can be there with their children. Especially from 5 to 11, they have to calm the children down before you can give the vaccine. At 5 to 11, it's hard for them to sit there for you to get the vaccine. So it's important for the parents to be there. So, I think we tend to rush into things, but we cannot rush on this one, especially with the children.
Doc, another age group that they're seeing lower numbers in is the 18 to 29 demographic. I think they said that, it was only 60% of them were fully vaccinated. What about that age demographic? Because it just seems like such a hard sell. Because 18 to 29, these are they're fit. They probably think they're gonna live forever. You know what I mean? They're probably thinking, I don't need the vaccine. And then when you have information like 7 people in the hospital, all 7 of them are vaccinated. I mean, it just kind of hurts the rep of the vaccine for, I think, a lot of these 18 to 29-year-olds. You know what I mean? They look at that and they're like, what's the point? So how do we reach them, or do we need to reach them, or we just forget it?
We need to reach them. The reason is, guys, when we have a low turnout for the booster. I mean, I'm not sure the percentage is about 30% or 35% of what's supposed to be where we are at this time. And again, campaign need to be out there to kind of let the people know why it's important to have the booster. I mean, I talk to my patient every day in the clinic, and I ask them the same question. First question, do you get your booster yet? Every time you see the patient. And most of them say, I'm fully vaccinated already. But when you talk to them, the vaccine, the second dose is back before April. And when you explain to them why you need the booster, they all get the booster because they don't know. And despite what we do on the radio and everything else, people still think that they got the 2 doses and that's it. Doesn't matter how long ago it need to be done. But we have to do the campaign to do that, because I tell you, coming this winter, we still have Delta on the island. And yes, the people in the hospital are fully vaccinated. If I don't know when the second dose that they have, but I would venture to say that most of them is outside their 4.5 to 6 months zone already. Yeah. So when you outside that zone, yes, you're gonna get infected. So if you think that you're fully vaccinated with 2 doses and you have no restriction, you won't get sick. And that's what we're afraid of, is that during the holiday, as we come in, we have to deal with the Delta still on the island, and the people that not fully protected, okay, not fully vaccinated, but not fully protected, will get sick during the holiday because to get together. And on top of that, Omicron will get here sooner or later,
Right.
on the island. And the combination of Omicron and Delta, do we expect to have a surge during the holiday? Yeah, maybe. And that's the scary part about it. So I don't think that the Omicron is on the island yet. It's very infectious. And so we usually see a rise in the positive in the clinic. We haven't seen it yet. So, the longer we wait, the better. So it gives us more time to get our people to get their booster in order to protect themselves. And, the study say booster, when they increase your neutralizing antibody a whole lot, 25-fold is a big, big jump in order to protect yourself during the holiday. But again, we have to go out there and let the people know about why they need to have the booster.
Yeah.
Like I said, it's really work to cut down the severity of the illness if you get the level of neutralizing antibody that you have, about the booster. So, that's we're gonna see quite a few vaccinated people in the hospital, guys, and that's reality because the immunity are waning down on those people.
Right. Doc, there was when you talk about Omicron on Guam, there was a great story out of KUAM News here, interviewing Dr. Bob Leon Guerrero. He's the chief medical officer of the Department of Public Health, and he says, quote, most likely, to be honest, it's probably already here. We already know it's out in Hawaii with a guy that never traveled, so it's a good chance Omicron might be here already.
Yeah, like I say, Omicron is highly infectious, more than Delta. We have not seen a surge yet, only rise in the case in the clinic. So I would say that it will be here, but right now I don't think it's quite here yet. But it will be here because all travel back and forth through Hawaii. So no, we just have to brace for it. Once it gets here, you will see the rate going to go up. And the most important thing is that, this is not a study. There's data gathering say that because the mutation on the spike protein on the Omicron, that the people that recently got infected with the Delta can also get reinfected because of the mutation. So the people that recently got infected with the Delta within the last 3 months doesn't mean that if you put your guard down, that you will not get infected by the Omicron because, again, the mutation is a huge mutation of the spike protein that will break through the natural immunity of the infection, the people that the last 3 months. When you get infected, we say that you will be protected for the next 3 months, but data otherwise show different because of the mutation. So that's the more important role for people to go out there and get the booster. The only time that you cannot get the booster if you get the monoclonal antibody treatment with the last infection. You have to wait for 3 months. But if you get infected by Delta in the last 3 months, you don't have to wait for 3 months to get the booster. You can get it, once you clear.
Doc, what else are you seeing at the clinic level?
Right now we see a lot of cough and cold. But no, we test everyone that have symptoms. But so far, again, maybe in the past week or so, we see 2 positive. So that's a good thing. That's why I say Omicron more likely it will be here, but it's not here because you will see a rise in the positive in the community. Just like the Delta before, it's just Omicron is worse. But the good part about Omicron and that we see right now is that it looks like it have less severe symptom than the Delta, so that's a good part. The question is when it hit our community with a lot of comorbidity, what does it do? I don't know. That's something to be seen just because our population different than again South Africa. We have a lot more comorbidity, so anything can happen.
Right. So South Africa is like a younger. I read that somewhere. Like they're a younger population.
Yeah, the average age 27, and they're pretty. Most of them think South Africa is a poor country. They're pretty modern and they're pretty healthy. So 27 and healthy. Yeah, they just like us. When we're young and healthy, just like you say, 18 to 29, they healthy and they have mild symptoms. But again, we have a lot more comorbidity, so it's a little bit different. So it's something we have to see, but the best way that we can do is to truly to offer people the booster, and they want a booster, they need to come in and get them. And UOG are closing on the 15th December, guys, so you have another 5-6 days left. I wish they stay open, but again, access to the vaccine is going to be a lot less without them.
Yeah, that's interesting. Do you know, Doc, are you tracking when UOG closes? Are we going to see other outreaches popping up elsewhere?
Yeah, there's going to be, the public health put a lot of small outreach on the village. But again, it's UOG is very convenient for people to go to, and the guard did a beautiful job on that throughout the pandemic. So really need to say thank you for the guard to do that. That we cannot do without them.
Right.
Yeah. So get your booster. Get the campaign out there. People in the 4.5 to 6 minute out the window. They need to go in and get it for before the holiday. Again, Delta still on the island. It's not going anywhere. And if your immunity are down, we're all to get together, the family, protect yourself, and we all need to work towards the, to prevent the surge. And again, at this time, I point again, I wish that the governor and make decision that to get rid of the mandate with the vax and unvax. We get to the point here that we all have to work together within the two group to go through this pandemic, especially the next surge whenever it comes.
Can you kind of clarify something for me? Is it true that the Omicron variant, that children are more susceptible to get it?
Sabrina, yeah, the firm data we have is through South Africa, right? I mean, everyone else, I know it hit over 50 countries already, and over like 17, 18 states that have the Omicron. But South Africa, the only one that have the firm data, about I think 10% of the hospitalizations for children. Okay, so that's pretty high number. Because children usually don't end up in the hospital. With 1 out of 10 admission, that's kind of high on the Omicron. So again, we're still learning to see if that is true across the other nation and in the state. So far, I haven't read anything regarding any increase in pediatric admission in the state regarding Omicron yet. But again, we're only 2 weeks in, so we only have what we know about South Africa.
Yeah, Doc, I mean, I just want to go back to when we're talking about Omicron like this now, but there was a point where we were talking about Delta, this same conversation, and look what happened with the Delta. So, yeah, pretty crazy.
Yeah, we have to be cautious just because, like I say, our population, different with a lot of comorbidity. You have 20, 30 years old that have kidney disease because of poor control diabetes, on dialysis already. You hardly see that anywhere else except here. So our population, we have to treat differently, and I think we should be more aggressive to do that. At this point, with the surge just get over, I really like the public health to really go back to the drawing board on the table and really plan ahead for the next surge to identify what we need to do to correct our mistake in the last one and be very aggressive at the beginning and control the spread of the virus and not let it get out of control. That's through really rapid testing. They need to ramp that thing up really, really fast, and the contact tracing. That's what our mistake is in the last surge, is that we wait too long. So we really have to plan ahead of time. We can prevent that by do things correctly the first time.
You said we're like 2 weeks into this, but in other locations where Omicron is, has anyone, I guess, died from the Omicron variant that you know of, or how serious can you get sick from this?
Yeah, so far, Sabrina, the data from the state all point out that it's more infectious than the Delta, but the symptom is less severe.
Okay.
So that's what we know now. It might change the next day, right? Because as we have more data, but at this point, it looked like with the blessing is that it will be it have mild symptom. But again, the other side of the coin is that because the mutation, people that have the immunity from the Delta and the Alpha and everything that they're infected before, they can get reinfected again with the Omicron because the mutation is on the spike protein is different. So, no, if you get sick a month or two ago, you can get sick again with Omicron just because of mutation. So be careful. The best way is, again, wear your mask, social distance, wash your hand.
Amen.
Those three still remain the key for prevention of you getting the COVID infection. So don't forget that. We're going to be like that for a while.
And also for those who just will not get vaccinated, this is kind of the same thing. Just continue to stay healthy, take your vitamins and things like that.
Do your sit-ups.
The FDA and CDC now approve booster for 16 to 17. So I know my children will be excited to have it. So in 16, 17 now they can get the booster, the Pfizer only.
Right.
Mm-hmm.
Yeah. Yeah. They should do a jingle. Public health. They need to come out with a jingle.
Okay. I'm sure you can come up with something.
I know a guy who's a master jingler. Saying.
Okay.
Thank you.
Real quickly.
If you go get the booster, you can go outside and play with the rooster. I don't know.
Okay. And so.
You have to film about 14 days or 12 days before Christmas and New Year. So at least get the children go out there, at least get the first dose, and we get somewhat protected to get together for the holiday. And let's get a good holiday, Christmas and New Year, much more different. I passed by the again last night and lost people, a lot of lights, and I tell you, it's so good a feeling to see those things.
Me too. Yes, feels really good, Doc.
Yes.
Thank you. You good, Bree?
Yeah, I just wanted to again follow up. Any word on whether or not tier 2, tier 3 clinics are getting paid, reimbursed?
Did you get your Christmas money?
Yeah, Sabrina, we just recently got paid for a portion of what we do. So I know it's hard to go to work the government, and we got paid sooner or later. But yes, we did get a small portion of it the last week or so.
Nice. So you came on the link. You complained that you weren't getting paid, and then you got paid. There you go. Results.
Good job.
Thank you, Doc. Appreciate it.
But thank you so much for everything you guys do during the pandemic. It is a lot of help, and a lot of people listen to this link. So thank you for passing the message.
Thank you,
Always.
Doc.
Thank you, Doc.
You're welcome. Have a good day. Be safe, guys.
You too. 3 W's works. Hey, it's worked for me.
Okay.
It's worked for all of us, right?
Yes,
Okay.
it has.
Yep.
Yeah, you better
COVID free since 2020. Thank you, Doc. You would do a jingle about playing with your rooster.
That's the only thing I can think of. What else rhymes with booster? Simon and Schuster, the publishing company.
Yeah, maybe you would do it like a rhyme with a shot. Like you get your booster shot, something like that. Maybe. I don't know. I like that though. Go get your booster, then you can play with your rooster.
Yeah.
Cockfighting's totally legal.
Yeah, that's right.
It's 7:58. This is the link. Friday, December 10th. It's proudly brought to you by Pacific Points, Calvo Enterprises, IT&E, and Jack in the Box. Tomas Maglotnia with NMI Regional News coming up. Plus, as we always do on a Friday, we got Feed Me Fridays.
Even more food on a Friday.